The term palpitations is a general term used for abnormal sensation of your heartbeat. So a patient will say, I've got palpitations, and it can mean a range of different things. So it might be, for example, a patient says, I can feel my heart beating quickly, or it beats irregularly, or it's missing beats, or extra beats, or just being very aware of strong beats. All of those come under the umbrella of palpitations. So essentially, palpitations is a symptom that a patient experiences that tells them my heart doesn't feel right in beating inside me. Palpitations are amongst the most common symptoms patients present with, and probably most of us experience palpitations at some point in our life. For example, if you are stressed or frightened, or perhaps if you've been exerting yourself more than usual, your heart might feel strange and abnormal, and you could call that palpitations. But more generally, patients presented to doctors will present at all ages, ranging from teenage years right all the way up to people being in their 80s and 90s. Although the causes of palpitations in different age groups varies. So palpitations that are symptoms that patients experience may represent a number of different things going on in the heart. So first of all, it might be your normal heartbeat that a patient is aware of, and that normal heartbeat may be faster than usual. So it could be going, for example, instead of going at 80 or 90 beats per minute, it might be going at 100 or 110 beats per minute, and that patient is aware of it. So that's one thing. So it's your normal heartbeat, either a bit faster or just beating strongly. So that's one group. Another group of conditions that might be causing palpitations are known as ectopic beats. These are extra beats that are coming from either the top of the heart or the bottom of the heart, and they are coming in the middle of your heartbeat. So it's a bit like a driver cutting in on you when you're on the road, and it disturbs the flow. And people are aware of that change in flow. They might describe a little flutter or a little bump or extra beat or a misbeat. And that can happen at any time. Most notably, people will describe that at rest or at night when they're lying down. And so the ectopic beats might be, these extra beats might be another thing that's going on in the heart, causing the patient to have palpitations. The third group, and the one that perhaps cardiologists are always on the lookout for and worry patients the most, is there a heart irregularity, what we call an arrhythmia going on, that is causing the palpitations? So this might be a range of irregularities. Perhaps the most common one is something called atrial fibrillation, but there's a whole host of other potential arrhythmias and irregularities that might affect individuals at different ages. And those are, when they're picked up, very amenable to treatment. They very rarely a cause for worry or concern, as they can be treated very well um, with both medication and other procedures that are available to us today. One of the things patients want to know is what they can do if they get palpitations. I think the first and important thing is to know why you've got palpitations, what the underlying issue is. Is it your normal heartbeat? Is it ectopic beats? Is it an arrhythmia? So knowing what it is important. The second thing I think is important is for a patient not to be worried or frightened by them, because they do scare most people or worry most people. Because people think, oh, they're going to have a heart attack, which they're not because of palpitations, and they think, oh, something awful is going to happen to them. And again, that is not the case in the vast majority of cases. So knowing what it is, and therefore what the significance of it is to them, is really important. And that, I think, reassures people a lot, understanding what it is. Then, depending on the type of condition that's causing it, there's different measures that you might employ, and it depends on the underlying condition. So, for example, if it's something called sinus tachycardia, i.e., your normal heart rate beating a bit quickly, you might think, well, am I a bit stressed? And you take some relaxation techniques and others to calm yourself down. If it's atrial fibrillation, for example, some patients, depending on the type of condition they have, may have a particular medication they can take at the time. And another group of conditions that tend to affect younger people are often referred to as SVTs, or supraventricular tachycardias. But these are little short circuits that happen in the heart where the heart can beat very rapidly, very quickly. And then there's some maneuvers that patients can try at home to see if they can stop these very rapid heartbeats. So there's a range of things, but for many patients, above and beyond what they might be able to do, that there's a different medications and treatments that we can give to either reduce the impact of their palpitations on them, their symptoms, or to prevent them happening at all. So again, there's a whole host of things that one can try. But again, having a conversation with your doctor, with your cardiologist, they can go through the different options with you and say, right, this is how we can help and stop the palpitations occurring at home. Palpitations, for the most part, should not be a cause for great worry or concern. There are a few times where we do become a little bit more concerned about palpitations. So, for example, if the palpitations are associated with blackout, that's a bit of a red flag for us as cardiologists and as doctors. If palpitations are associated with chest pain or breathlessness, that's important to know. If you have a family history of some inherited cardiac condition or some sudden cardiac deaths, and you are also experiencing palpitations, again, that would be something that I think would merit early review by a doctor. But in general, most other individuals who are getting palpitations in isolation, who don't have sudden palpitations when they're exerting themselves or blacking out, or don't have a family history, they can be seen by their GPs or by a cardiologist to ascertain what's causing them and reassure them and treat them. Because some of the palpitation, whilst not being necessarily dangerous to the individual straight away, such as atrial fibrillation, still need a treatment, for example, treatment to prevent strokes. So it's important that if you do have palpitations, you see somebody to work out what's causing them and whether there's any treatments that are important that they are started on.